Hello everyone, welcome to this audio podcast. In this series, in this Storm Robotics production series, in this series, the Dezrztorm Didactic. This is an RPSG and the Robotics collaborative, and we're in this particular audio podcast will be about using the internet and online methods or modalities for data data collection and a sort of a retrospective review on applications. And this work on this sort of overview around this particular scientific this scientific aspect is in run up to or in line aligned to the in aligned to and in run up to the International Pediatric Transplantation Association, or IPTA 2023. And alongside with this, there will be a few other audio podcasts aligned to this particular audio podcast series around the Dezrztorm Didactic. So once again, this is the Shientist, and I'm gonna provide an overview of this. So the aim of this research of this works or this audio podcast even is to highlight a sort of a retrospective review on number one, online methods or modalities for qualitative and quantitative data collection in research in context of scientific or scientific based research, and two, to explore consent and ethical issues in and around using the internet and online methods or modalities in context of research, and number three, and also the implications for future prospective sort of practices. So to begin with a bit of background. A research using the internet provides sort of unparalleled opportunities for subject access, and it is not limited by constraints of time or geography. There's work that actually goes back to sort of back to early 2000s. In the early 2000s, by Eisenbach and Till in 2001. Qualitative research or qualitative work tends to has an aim to convert visual or narrative data into non-quantitative outcomes. So asking the questions around, for example, the what, why, and how, but not how many or how frequently. And it also characterized by its own distinctive vocabulary. And work by Babur before the new millennium, or before early 2000 in 1999, looked at aspects in and around the vocabulary aspects around qualitative research, and also where it reached and wherein in around this qualitative research has been has been implemented in various specialties, and reaches across specialties and sort of reaches across healthcare specialties and disciplines. So the qualitative data, sort of data collection model sort of aims to complement quantitative research or studies or investigations by producing sort of records of semi-structured dialogue or focus group conversations, for example, observational research or film capture, documentary, inquiry, or survey. And again, Barbour in 2000 sort of highlights some context around this. An example of relevant an example, for example, in context of research is also sort of nursing research as well as other specialties in healthcare. For example, and there was an investigation or study, an interview based study or investigation on for example, on the experience of National Health Service or NHS care and treatment in lymphoma patients or recipients, and works by Zebland in 2011 looks to highlight the investigation and around this more sort of in more sort of depth. Data collection has thus become increasingly important in across different areas of healthcare and specialties, and in this context, aligned to allied health professional research or AHP research. However, the emphasis on evidence-based medicine or EBM, together with the recognition of the importance of quality of life, for example, has prompted healthcare professionals of various specialties to sort of acknowledge the value of qualitative methodologies, which various methodologies, qualitative methodologies, which can provide a sort of a new dimension of data relating to experiences, attitudes, and beliefs in order to inform and develop better healthcare strategies. Now, in and around this works, there was a literature review had been conducted, but in order to get to the basis around the literature review, I'm going to highlight some aspects around the design and methodology in and around this. So two searches were carried out. For example, number one, using sort of databases such as PubMed Central and Medline databases, and two, using EBSCO Host Engine, which links to where EBSCO Host Engine database has a link with Signal Plus, Psychology and Behavioral Sciences Collection, Health Source, Nursing and Academic Edition, International Bibliography of Social Sciences, SOC Index, and SOC Index Full, and Sci Info, and the data the search, the database search, or the literature review and around this took place in around between 1995 and 2013 implementing in both search engines. The main terminologies used that were used in the search through both search engines and databases included the following. So, for example, qualitative research, quantitative research, online data collection, World Wide Web, the internet, and at the same time, a Critical Appraisal Skills Programme, a CASP tool, was used to analyze different papers accordingly. Now, in context around this, I'm now going to highlight some aspects around the results, or the synthesis of the results around this. So after abstract quality appraisal, quality appraisal, 54 papers have been identified as being relevant to this review, and where from search one, 19 from so 54 papers have been identified through search database, through the first set of databases, and 19 papers had been identified through the second lot of search engines and databases. So from the abstracts, 5 research themes had been identified. Now these five themes have been have been identified between both of the in between both of the search engines as part of this literature review. So findings indicate or prompted that in the internet internet research expedites outcomes when compared to conventional methods or modalities, and is a practical alternative for example, interviewing validating measures in context in context and specific to for example, quantitative or survey focused research, and studying sort of susceptible populations as well. And however, only 10 of the papers reviewed involve the implementation of online methods specifically to collect qualitative as opposed to quantitative data collection. Now, the variety of web-based platforms allows greater scope for data collection and in regard to a variety of research specialties or disciplines. And again, there's works by Eisenbach and Till from 2001, and Eisenbach and Wyatt in 2002 that quite nicely highlight the sort of a basis around this. Now, the privacy that the internet, for example, questionnaires improves data value by reducing response bias. Confidentiality is believed to prompt assurance in participants, enabling them to reply to delicate questions more openly, and reducing reply partiality and investigator inclined preference, thus improving the truthfulness and the factual content of exchanges. There's works by Cantrell and Lupinacci in 2007 that look into this. This applies to quantitative questions or questions in context of quantitative based research. Providing methods of metric analysis have proven quality and provenance. For further reading around this, and there's works by Griggs in 2011, who provides an evaluation of the internet as a basis for gathering, for example, gathering sort of ethnographic data in context in between sort of quantitative qualitative research wherein combination is mixed methodology. Now, in around this and sort of the results in and around this literature review, I'm now going to highlight some context around the different themes, the 5 themes that have been identified through this works. So theme 1 was about using different media to collect data. Now, online research methodologies allow scope for investigators to create, for example, or develop web pages to collect from specific diverse populations. And there's several authors that have sort of retrospectively have looked into this. So, for example, Adair and team in 2006, Birnbaum in 2005, 2004, Burgess Burgess in and team in 2001, Cantra again and Lupicini in 2007, and Suarez Balcazar and team in 2009, and to readily save data in text format for importing into secondary data analysis programs as well. Now, it was Kanzakian team in 2004 provide a good example of an investigation or study using web-based data collection to gather qualitative to gather mixed methodologies based context and information in regard to daily coping experiences of Japanese patients with rheumatoid arthritis. The study used an online survey delivered by email and the use of e-diaries which were submitted by respondents through a personal blog, giving access to both patient and investigator for interaction and analysis. This approach was recommended for sort of prospective research with patients with other long-term conditions, long-term conditions or long-standing conditions, for example, chronic kidney disease or CKD. Now, in line to theme 1, I'm now going to highlight a little bit around theme 2, which was to do with maximizing responses. So online surveys and questionnaires consist of structured and closed questions and can be posted to news groups, email lists, email directly to participants, or placed onto web pages or websites. Using for example, an email link, or providing an uncomplicated universal resource locator or URL, thus permitting a sort of a better distribution to broader audiences. And when compared to, for example, traditional postal questionnaires, the internet or email surveys can give a sort of an increased response rates whilst reducing the risk of multiple responses from individuals. And in addition, there can be greater speed and the advantage of asynchronous communication and the absence of intermediaries. There's works by Daly and team in 2003 and Metzger and team in 2003 as well, in and around sort of highlighting how researchers, investigators can maximize on the responses, implementing survey-based research. And there is a growing body of literature regard to or relating to online data collection, and guidance is generally readily available. And there's works by Armstrong and Powell in 2009, and Duncan and team in 2003, and again Kanzaki and team in 2004. I'm now going to highlight a little bit around theme 3, using the internet and data, using the internet to collect data, and the validity and reliability aspect around this. Now, research populations that are difficult to reach can generally be challenging, especially when it's hard to reach populations are where for example, investigators and researchers, especially in those specialties in healthcare where it's not known completely whether certain aspects of healthcare are in context of healthcare, whether in those hard to reach populations that certain aspects of healthcare have actually been successful or are at an advantage, where they've been advantaged. And so research populations that are difficult to reach can be challenging, and it is important, whatever the data collection implemented, that the design and purpose or the aims and objectives of the investigation are reliable and effective when using online modalities or methodologies to retrieve information. And then again, there's works by Armstrong and Powell in 2009, Birnbaum in 2004, Burgess and team in 2001, and there are and around this there's other researchers as well. Now in around this, there's also the sort of the advertising aspects. Now the advertising of research with an internet premise or basis can encourage volunteering by genuinely genuinely interested participants, and thereby enhancing sort of the value of research outcomes, and broaden the range of participant backgrounds or diversity, as seen with sufferers of particular chronic illnesses. Again, works by Cantra and Lupacini in 2007 sort of highlight some aspects around this. Now, the validation of data collection research should involve a comparison of internet and traditional information basis to identify bias, but also to identify participant bias, but also to prevent participant bias as well. There's works by Bliven in 2001 that highlight in and around this. Now, theme 4, I'm going to highlight some aspects around the ethics and confidentiality aspects. Now, an investigation into sort of lifestyle in a small group of participants who were identified as having colon cancer assess the feasibility and comparability between face-to-face versus online communication. And throughout the study or the investigation, a project coordinator could be contacted by email and telephone to answer additional questions about protocol and confidentiality. Findings indicated that in the internet mediated um, uh, internet mediated chat chat focus groups for ill or disabled participants can be a more acceptable forum for disclosing sensitive information than face-to-face groups. In considering confidentiality, it is important also to bear in mind that focus groups using traditional modalities, uh, traditional sort of modalities, and although participant privacy can be maintained, research may not supply sufficient detail where delicate or sensitive in sensitive sufficient detail where delicate or sensitive or individual themes or manners are relating to divergence are required. And so using either a traditional or online approaches, a group leader or a moderator in and around the ethics and sort of the confidentiality aspects of sort of using the internet on online modalities for data collection and context of healthcare research or or research may face or can may face sort of the same challenges the same sort of challenges encouraging the same sort of challenges but also where where the sort of investigators should encourage are encouraged to sort of vocalize sort of viewpoints in and around that. Now, theme five. I'm going to highlight a little bit around the sort of advantages and disadvantages and limitations. So, internet access is and has become more accessible to the general population and sort of gradually reducing. Gradually, there's been sort of reducing the costs and around that. The global expansion of broadband networks has been rapid for both, and so for both reasons, access for participants is becoming less of an issue for online researchers. And there's works by again Atkinson and team in 2007 that have looked into some aspects around this. The most critical limitation to the success of internet research or internet-based or focused research is the satisfactory design of and preparation for research projects, which make the communication of actions and choices to participants transparent, consistent, and consistent. Um, Several authors sort of have reported on the advantages and disadvantages and limitations of conducting online research. So, for example, Bergman and team in 2008, Fox and team in 2007, Geis and team in 2007, Sutter and Klein in 2007 as well. I'm not going to highlight or sort of provide a sort of a basis around the advantage of traditional face-to-face focus groups versus online focus group modalities. And I'm going to do this by sort of highlighting context, sort of in a sort of a comparative from a comparative basis, where where we're comparing the bases by looking at the from the literature, highlighting comparison between between face-to-face focus groups versus online. And so from a traditional face-to-face focus groups, there can be more expansive communication. For example, the narratives and sort of the underpinnings exist. And compared to online focus group, there can be less there can be less digression, or there can be less digression occurs due to brevity. In context of traditional face-to-face focus groups as well, there's visibility of body language allows the moderator or investigator to pick up on signs of frustration or anger or discomfort, and in online focus groups, for example, that the body language can sort of remain hidden, and there is an increased willingness online focus groups. There is an increased willingness to share and discuss sensitive issues, sensitive, vulnerable sort of issues in one way or another, due to greater desire to communicate in some way, in one way or another. And then whereas and in addition, where online chat allows broader broader audiences to join in communication in one way or some way or another. In traditional face-to-face focus groups, another aspect is meeting site is set it tends to get set beforehand, and online focus groups, for example, transportation ability to follow directions to meeting site, and parking, for example, become non-issues because they're not because online it's not particularly important or applicable. In traditional face-to-face focus groups, also participants are presumed to reflect views like those who will be in a study, in an investigation. And traditional face-to-face focus groups also allows verification of face-to-face participants at the same geographic area. However, a study may want different people to represent different ideas or different views, and traditional focus group interactions allow verification of all different participants, but at the same time not all may want to participate in on the same day, at the same day. And in context of in context of focus group or focus group based research, for example, in generally where participants are not do not participate on the same day, then for the researcher investigator who's looking to collect data in and around an important subject entity, then it generally defeats the purpose. And online focus groups, for example, a broad geographic area can be can be reached, and this allows a verification of face-to-face participant concerns, viewpoints as local or more as local or sort of global. However, the disadvantage around this or online focus groups is that um, is that um, those for the moderator or the investigator when seeking to have participants involved, in order to have a sort of focus groups or conduct focus groups online, for example, then the disadvantage for the investigator or the moderator, for example, may well be where participants, for example, or may not want to share, for example, email addresses, for example, in order to be involved in online chats, in an online focus group, for example. Another aspect is traditional face to in around traditional face-to-face focus group. There can be more group interaction, and the group dynamic can exist. In online focus groups, there can be there is a basis there can be advantage in the same way. However, there's also less chance of dominance by one person, with a sort of with one person sort of having a round robin sort of approach. And On traditional focus face-to-face focus group, also there can be the internet or the World Wide Web, for example, is generally not required. However, in online focus groups, for example, there can be easy access, owing to the internet being available, especially where now for most investigators or researchers, there can be the use of lots of different ways to access access the internet, through whether that might be, for example, a smartphone device, a device, or a computer, etc. And also traditional face-to-face focus groups, for example, may not be appealing in recruiting an ethically diverse population, because there may be issues with literacy, or the access to computers, or understanding, or even understanding the use of internet or computers. In online focus groups, for example, in context of research, and in context of research, physical health, symptoms, and ability to travel are not deterrents to participation. This sort of overview around this, the sort of advantages and disadvantages, if you like, or more advantages of both modalities, can be identified from works by Kramish and team in 2001, and there would be more. There have been more works that have been published more recently in and around this as well. The conclusions around this works are as thus. So this review sort of identifies 73 papers, specifically using 2 searches, but only 10 papers reviewed involved the implementation of online methods to collect qualitative data, and findings highlight findings highlight that generally the internet offers novel opportunities for researchers across different specialties. Collective quantitative and qualitative research data has generally entered a new era, and freely available software and a range of IT applications permit new opportunities and greater flexibility in the development of investigations and research studies. However, data comparison continues to require a blend of modalities, thus traditional modalities and online modalities. Online data collection for health research includes advantages of increased can include advantages of increased participation of subjects in minority or hard to reach groups, investigating sensitive issues, and gathering data from populations otherwise dispersed. So, for example, people with low incidence conditions and or different and or across disabilities, and ultimately it is vital or pivotal that researchers or investigators using online data collection adhere to strict ethical principles and seek to develop guidelines based on experiences. There are several further research. There are several references or citations that are included in the original works, and online. There will be a basis where some of those citations will be included online and through social media. So once again, I want to say thank you for joining for listening in on this audio podcast. This has been an RPSG. It's an RPSG and Robotics collaborative. In this series, the Dezrztorm Didactic. This has been another Storm Robotics production on using online. Using the internet online methods or modalities for data collection, and this has been a retrospective review on applications. Thank you for tuning in or listening in on this audio podcast. Thank you.